Good evening, everyone. Am I audible? Good evening. Am I audible?
Akshaya, songs of Akshaya. Sorry.
Yes, ma'am.
Love songs.
Okay. Thank you so much for replying.
Bluetooth లేదా
Good evening,
ఏమీ లేదు.
everyone. Welcome to Intern Spotlight. This event has been organized by the hosting team at CliMed. I'm your host, Aisha
రమ్య
Nasir. Through Intern Spotlight,
బ్లూటూత్ ఉందా నీ దగ్గర?
can you please mute yourself?
నేను పెడతాను నీ టీవీ సాంగ్స్.
Thank you. This event has been organized by the hosting club at CliMed, and I'm your host, Aisha Nasir. Through Intern Spotlight, we not only celebrate our interns' achievements, but we also learn from them. Today, we are pleased to introduce you to Dr. Aparna Matpathi. Dr. Aparna is a clinical research coordinator at AIG hospitals in Hyderabad. She has made contributions to medical literature, including research articles, several rare case reports, adverse drug reaction case reports, and a chapter in recent research in medical and life sciences. She has also been a peer reviewer for several journals. Welcome, Dr. Aparna.
Thank you, Aisha. Good evening, everyone. Myself, Aparna. I've completed my PharmD from CMR College of Pharmacy and internship from Gandhi Hospital, Hyderabad. I'm graduated in July 2023. Coming to my interests, I'm basically interested in the domain of clinical research only, and a little bit more fascinated towards stem cell therapy and the research included in stem cell therapy. Even though they are associated with cancers and all, but still I'm a little bit fascinated towards them. Coming to my professional journey, it started from the internship itself, like identifying major drug interactions, moderate drug interactions, adverse drug reactions, any drug related problems like therapeutic duplication, wrong dosage, wrong route of administration, their frequencies, and we tried to publish a few cases during the internship itself, which helped us a lot in gaining knowledge and in career development.
Record sound system.
Thank you so much for introducing yourself. Vijay, can you please mute yourself? Thank you so much. Please keep in mind to mute yourselves because it keeps interrupting. Thank you, Dr. Aparna. Can you please tell us how you first got involved in research and medical writing?
Yes, actually, it all started with our principal sir, as he was very enthusiastic person in clinical research. He encouraged us in several research activities, as well as our faculty members. They advised us to publish case reports during our internship, and they helped us guiding in the field of clinical research. And slowly, we started developing our personal interest as well in publishing, as we come to know that we come to know little bit detailed information regarding every case now when we publish the case report. So from the beginning itself, like when we go for hospital visits during our second year, from then itself I got interested in hospital activities, but not much into research. But during internship and all, we were involved in clinical research as well, like presenting the case reports and publishing them as well. Like, faculty and principal, they guided us in the publication process.
Okay. So since the topic of this episode is case reports, we want to learn how to select case reports and how to go about doing this from you. So the first question related to that is, what can you walk us through the process of selecting a case report? So when you come across a case, what makes it reportable?
Yeah. Because whenever we go for ward rounds now, we need to study, like just we'll just go across the cases in the hospital. We need to study the case completely, so that we'll get information regarding the case. In order to make it reportable, we need to have scientific evidence as well. It should be scientifically correct, and like it has to be a case. We can also report adverse drug reactions as well. First of all, the case has to be a complete case, like from the admission till the discharge of the patient. We need all the information, whatever it is required to publish a case report. And then if we want to publish, then it has to be rare, or else it has to be an interesting case, so that it will be interesting for the readers, as well as it should be it should be capable of providing enough knowledge for the readers. Whenever they go through our case report, they need to get the knowledge, as well as it should contribute something to the existing scientific literature.
Okay. So when you write these case reports, what methodologies do you use? Like, what is the process of writing the case report?
Yeah. Methodology. First of all, title selection will be there. In the title selection, we need to select the title depending on the case report which we want to publish. Like the title should be such a way that it should attract more number of readers. And then we need to prepare abstract, which we have to put all the summaries related to the case report in the abstract. We need to summarize the whole case report in a short form in the abstract. We need to use keywords as well. In the keyword section, whenever we are adding few keywords now, they should be in such a way that whenever a search, they should appear quickly in the search, like short. Like for example, if we report about tyrosinemia and all, like we need to put all the main elements in the keywords. And then coming to introduction, we need to include the background of the case, definition of the case, epidemiology, etiology, and also how it contributes to the medical literature, existing medical literature. Case presentation, then in case presentation, we need to include details like demographic details of the patient, their age, gender, and what the complaints he or she presented in the hospital, chief complaints. And then we have to put the clinical data as well, like laboratory details which are relevant to the case report. Like in general, we'll find so much lab data, but all that is not required. Whatever is related or relevant to the case which we want to report, only that we need to enter in the case presentation. And then treatment plan, what are the treatment strategies implemented in the in getting the required therapeutic outcome, we have to mention it. And what outcome we gained after giving the therapy. And then after treatment, we need to give the importance of counseling the patient or the attenders. If the patient is a pediatric person, then he or she might not be able to understand the counseling points. So we need to mention how we can help the attenders or their parents in helping the patient cure well. In discussion section, we need to compare the existing literature with our case report, like whether it is contradicted or whether it is similar to the existing literature and all. We need to like correlate them, and we need to mention it. While writing discussion, we can take the help of our faculty members or doctors as well, because writing discussion is a little bit tricky, I guess, because we need to give a point. Now we need to clarify it everything, so we can take the help of faculty members and doctors as well. And then comes conclusion. In conclusion, we need to conclude our point, like what we want to give, what we want to explain to the whole case report, concluding it
So when
in
you're
a
when you're writing these case reports, how do you deal with patient confidentiality? Like, how do you approach the patient?
yeah, none of the patient details by which we can identify a person should be revealed. Like everything has to be kept confidential itself. We should not reveal any factor or any aspect by which we can identify a particular person. So being ethical and maintaining confidentiality is very much important. We need to take consent of the from the patient also, that we need to say them, that tell them, that inform them that your case is for publication. We need to take consent from the patient and give a clarity to the patient that none of the identifiable factors will be revealed in the case report.
Okay. So since you have so much experience writing case reports, and to name one of the case reports you've written was on tyrosinemia type 1, and there's several other. So can you tell us a little about, like, what were the different reports you've written?
Yeah. coming to different sort of case reports, we have published a few case reports, which are mostly 4 of them are rare case reports, and remaining are like adverse drug reactions. The reason we have published these case reports was they have some scientific importance, because as they are already rare cases, so there won't be much literature available on them. So in order to contribute to the existing literature, we have written on them. Coming to tyrosinemia, it was a pediatric case in which there will be accumulation of tyrosine in the blood, which is an amino acid actually. So the reason for reporting tyrosinemia was, in India, most of the people are vegetarians itself. So it will be a little bit more difficult for them to maintain a protein deficient diet, because pulses and protein like milk products and all will be consuming, because vegetarians will be consuming, and explaining them regarding protein restriction is necessary, because the standalone treatment of nitisinone, which is the first line therapy for tyrosinemia, won't
Just a second, Dr. Aparna.
as well as attenders or parents regarding protein restriction. The importance of protein restriction is very much important in tyrosinemia case. So that was also one of the reason, as it could be helpful for the readers to know the importance of maintenance to cure a particular disease, because only drugs may not be helpful to cure certain disorders without maintaining proper diet and all. So coming to adverse drug reactions, most commonly used drug was terbinafine for fungal infections. It's commonly used, and most of the times it won't be causing any adverse drug reaction. But in one of our case reports which we have reported, it caused a severe, but which is rare but also severe Steven Johnson syndrome, and toxic epidermal necrosis was occurred because of terbinafine. Even though it was a very commonly used medication, it caused this such a very dreadful adverse drug reaction. So it also helps in the improving the knowledge, or in showing some light on the topic of adverse drug reactions, that how a drug can cause, a drug which is used to cure a disease may induce certain unwanted side effects like SGST and syndrome and all. As well as NSAIDs, coming to them, they are the most commonly used drugs. Like for anything, they'll be prescribing NSAIDs commonly. So writing a case report on NSAIDs induced AKI was also very, even though it is a commonly occurring ADR itself, but it was important at that time to be written. So we have contributed for that as well.
Okay, so now we talked about how you write a case report and what are the different steps involved. And so can you tell us, do you have any tips for someone who might be writing a case report?
Yeah, I'll guide them. First of all, you just go participate thoroughly when you go to hospital ward rounds and all. Like try to look at the case sheets, like how many like so many case sheets will be there. Try to look at a few case sheets every day whenever you go for hospital rounds and all. If you find any case interesting, or if you think that that particular case is worth publishing and all, then if it is an ADR, or if it's a rare in occurrence and all, then you just go follow up the cases regularly. If you find a case interesting, then follow it up regularly, and make sure you follow it till it gets discharged and all. Then study the case thoroughly, understand the case, and study it. If you don't understand anything, ask your faculty, doctors, any doubt you are having, and then start medical writing part. While writing, make sure that you use simpler terms and simpler sentences, as very much long sentences will not be appealing for the readers, and it will be a little difficult for us to comprehend. So try to use shorter sentences, simpler sentences. Language has to be simplified, because readers will not always be the professional ones. Like readers can be of all other categories as well. Like parents of the patient might read, or anyone can read now. So make sure you use a simpler language, and also try to focus on grammar as well. Punctuations, grammar, all little things matters in case report. That's it. study the case and understanding the case is very much important, and you need to you need to justify whether it is worth publishing and whether it contributes to the literature or whether it is important to be published.
Now that we know how to write a report and how to select a case, can you tell us about the publishing process? Like, how do you select your journals to publish in?
Yeah, I use a strategy like I'll first of all I'll we know the topic of our case report, so I'll go to the journals which are relevant to the topic which we have selected, like the journals which publish the articles which are related to our topic. Like if you are writing about acute kidney injury, then go for journals related to nephrology, or if you're writing about any GBS or any neurological disorder, go for neurology related journals, like the gastroenterology related journals. And then you go for the time taken for them to publish, because for case reports now we can't wait for 6-7 months. Like basically we'll be having short period of time, so if you can wait, there's no problem. Like go for time period as well, how much time they'll take to publish, publication charges, and indexing is also very much important. Go for indexing like PubMed, Publons, Scopus, and Web of Science as well. Scopus, it's a little bit difficult for publishing case report, but you can go for PubMed, Publons also, because even they have a very wider range of reach to the audience. So it will be helpful. And then look for index, and indexing is also important. And we need to look at the credibility of the journal as well, because lot of like predatory journals are also available online, so we should be very careful in that aspect as well. We need to cross check once, we need to take guidance from our elders like faculty and all, and then we need to go ahead with publication process.
When you write these case reports, you write it with a group of people, right? So how do you collaborate with them? Are they also pharmacy students, or are they other healthcare professionals? So how do you get them to, work with you?
Actually, when we go for ward rounds itself, all of us will collectively look at the cases. So at that time, we'll be deciding with whom we want to publish. With like, we'll be deciding at that time itself. And after that, few of my only one of my case report is with doctor ma'am. So whenever we go to the hospital visit, but if the doctor is free, we'll go and we'll speak to them, we'll talk to them, we'll ask them, we'll request them to look at the case report. She'll be reading all the case reports, and they'll be saying us this needs to be changed or this is wrong, you need to change this is one mistakes and all, they'll point out and they'll say us. Mostly we'll be collaborating in WhatsApp only, like chatting and all. By PDF we'll be sending to the other person, and collectively we'll be doing the work.
So they
Sending
are
to
also
the
pharmacy students.
yeah form the students itself.
Okay.
Only in one case report we collaborated with doctor ma'am.
Since you have also written a chapter in a book, recent research in medical and life sciences, can you tell us about how you found out about it, how you did it, what was the process?
For me, in this case, what happened was there was a conference conducted by a college. Like normal conferences will be attending now during our Form D 6 years. They conducted a conference, and in that conference, I gave a presentation on tenofovir-induced nephrotoxicity. So they have mentioned that they want to publish it as well. So I went ahead and I presented the case in the conference itself, and it got selected, and they published it. They went ahead and they helped in publishing it.
Okay, so through conferences also we
Yeah.
can get our works published.
Yeah.
So now we're going to move on to your role as a peer reviewer, and I'm talking about the previous ones you have done. So you have reviewed in several journals till now. So how did you find out about it?
Actually, I didn't find. I don't even know the review process will be there and will be eligible for reviewing and all. Actually, we have written a case report named turbinafine-induced Stevens-Johnson syndrome and toxic epidermal necrolysis overlap syndrome. Due to that case report, now I got so many journals approached me. First of all, they approached me to publish a paper in their journal, which we have will like we can't publish a paper if we don't have a case report with us now. So we neglected it, and one opportunity I got as a reviewer from that journal itself. From one of the journals, they only sent me the review. Like they only requested me to review a paper and all. They sent me the documents, and I reviewed and submitted the review form to them. So it happened because of a case report which we have published. As I was the corresponding author now, so they have sent it to me itself. So correspondence also is important, is what I feel. And also the case report which we have published, it has to reach a wider range of audience, and it should be like it should have content in it. So they have approached me, they only have approached me. I just went through the process and all. Whatever they have mentioned, I just went through it and I have reviewed the papers. So after reviewing one manuscript, they started sending me few more manuscripts. So that way it happened from one case report.
Okay, so through writing one paper, you were able to get other
Become a
opportunities.
reviewer also. Yeah.
Okay. So since now that you have so much experience with reviewing papers, because you have done it for so many journals, what have you learned during this process? And
Yeah, writing a case report is also very requires a lot of skill. Even reviewing the papers will also teach us a lot of things, because we'll be going through different types of manuscripts, because sometimes we'll be going across big research papers as well. If they send us to do a review process, they'll be giving us a big research papers as well. So by reading that research papers, we'll get a lot of knowledge how to write a paper. Like it also contributes, it also helps us to improve our writing skills as well as an author, like how to write, how it will be easier for readers to comprehend the content and all. So research papers, reviewing manuscripts is very much helpful. And also case report writing also, it will get improved if you review the papers and all, because reading a paper is different and reviewing a paper is different. Now if you read a paper, you'll read to comprehend, and you read to understand what this case report says. But reviewing a paper, you need to read each and every line. We need to check for any grammatical errors, any scientific errors. Whatever we find needs to be changed, we need to do. And in order to review a single review paper, we also need to gain some knowledge now. So for that, we'll be reading again, like few other case reports we'll be reading. So it helps a lot in gaining knowledge. uh, Writing also is very much helpful. Reviewing is also very much helpful in improving our writing skills.
when you peer review these papers, is there anything you notice that has influenced your writing style?
Yeah, it definitely helps us, because initially what happened was there, in few of my case reports, like there was missing continuation, like from one para to another para, little like continuation mistake was there. After reviewing papers, I even understood that there has to be some continuation between the lines which we write, between the paragraphs which we write. Like both have to be complemented with each other, and that was one thing. And also it helped me a lot in improving the comprehension capability of papers, because while reading, we'll be reading it to just get the output of it now. But while reviewing, we'll read it like very keen interest, we'll be reading it. So
When you go through these manuscripts, what is like the main error that you see, like you in these papers?
most commonly seen
Common mistake.
yeah commonly seen mistakes are like grammatical mistakes, punctuation mistakes. Like few of them will be like some little typing mistakes will be there. Like in one paragraph they'll be mentioning one thing, and exact opposite will be there in another paragraph. So that will be there. Sometimes people will be like directly copy pasting the things, so that may lead to plagiarism and all. So that also will I have seen in few cases. Like in only one case they have copy pasted few things, remaining all they have not. These
Okay.
are the common mistakes I've seen.
Again, coming to advice, do you have any advice for early professionals or students who want to publish case reports or ADR reports?
While if you want to publish, then you have to be very much active during your hospital rounds. Whenever you go to hospital, make sure you read at least one case every day. Like you need to study one case at least. Then after that, you will be getting some idea how a case will be there, like how treatment strategies will be implemented in a hospital, what sort of errors may happen, how areas will occur, like what whenever we won't be thinking ki very small drugs will cause some severe adverse reactions. Like in terminafin case, there was not much literature available, but it caused a severe ADR in that case. So we need to study the cases properly, try to interact with doctors as well to get your pharmacology strong, and then approach your faculty. If your faculty doesn't if they don't encourage you, you approach your faculty. You approach doctors as well, because we can publish with doctors also. Approach doctors, approach faculty. They'll be guiding us, they'll be helping us.
My next question was going to be about that. How can we approach our faculty and doctors? And what do you think is the best way to connect with them and our peers also?
Okay, so approaching doctors means like we need to look at the awards also, like in which unit which doctor will be there, or which doctor is dealing with the particular patient case report. Like we want to publish a case of one case from a patient, so which doctor is involved in the treatment. If we approach that doctor only, it will be helpful, because we need to get all the information correct now. And then in the hospital itself, we can approach them directly. Whenever the doctors are free, we need to go and approach them. We need to maintain contacts of them. We can directly call them or message them whenever they'll be getting free. We can directly go and interact them. I suggest going directly and interacting them rather than on calls and WhatsApp, because if we go directly, then they'll be guiding us correctly. I think that will be, even we'll be able to understand correctly what they want to say and all. Coming to faculty members, if you are really interested in publishing a case, not only case reports, if you are interested in publishing review articles, or if you want to conduct a mini research in your internship as well, you can take guidance from the faculty, because faculty members will help us. If you want to do a mini research, then you need to take ethical guidelines, like ethical committee approval and all, from your hospital and from your college. So at that time, our faculty will be helping us if you want to do a mini research. And review article writing also, you can take help from your faculty. Like you need to select an idea. First of all, you need to select an idea, and you need to select a particular topic, and then approach your faculty in helping you decide the title, like in helping you guiding what can be included, what can be excluded, what you want to do exactly. Like you can approach your faculty as well.
You just mentioned mini research, so we'll need to have some prerequisites, some guidelines and all. Can you tell us about that?
Okay. Like in clerkship, we'll be doing a project now, whole like complete project, which will be up to like 12 months approximately, or 10 months approximately. So mini research, we can do it for 6 months, we can do it for 4 months. Like we can collect the, like for example, you want to do a research on some particular topic, but you're not getting you don't have that much time, like of 1 year span. So you can reduce the count, and reducing the sample size, reducing the time taken, and then we can proceed forward by approaching our faculty and getting the ethical approval. We can do a mini research as well. Like it's nothing but it's also a research, but with a limited number of cases, and some little less time, which we can complete in less time.
Okay. This next question is I've recently seen on your LinkedIn that you've got 500 reads on ResearchGate. So congratulations on that. How
Thank
does that feel
It's
to
a
get recognized?
yeah, I feel very happy for getting that many reads. It all started with like 7 reads, I guess. Yeah, 7 reads, 13 reads, 25 reads, 50, 75. Slowly, it reached 500 reads, which made me happy actually. It's also encouraging for us, so that we can do more research and all. Like it's a very small achievement, but at this point of time, we need it. so that we can proceed forward and we can do more research work.
Yes. How did, like, which year did you start writing these case reports, or like which year did you start with writing in general, scientific writing?
Achha, with writing in journal, we started in our clerkship actually, fifth year. Fifth year, we had a project. So in that project, we used to do some little literature review and all. So at that time itself, we were involved in literature searching, literature writing, little bit. Even I was interested in writing. Still, I'm interested in medical writing and all. So from fifth year, during our internship, we were very like we were interested in medical writing. So after coming to sixth year, slowly we got to know the importance of publishing case reports, the importance of publishing adverse drug reactions, and our faculty also guided us. Principals have also insisted us so many times that publishing helps you a lot. So we got involved in publishing case reports. It started from fifth year itself. Like fifth year, I was not that good. Sixth year also, in the initial days, it was not that perfect. Slowly, it improved. Like after publishing few case reports, slowly, it got better.
What would you say is has been your most significant professional achievement so far?
Professional achievement, I can say that publishing a case report of terbinafine induced SGST and overlap syndrome only, because that's just a case report itself, but it made me a reviewer, a peer reviewer, and also like not only from one journal, like so many, like 3-4 journals, they have sent me peer review opportunity. So it all happened because of publishing this one case report only. So definitely that could be a small achievement. And also one more case report is also was also good, like factor and efficiency. So both of these are like achievements, because even our first salary will not give that much happiness that we get by reviewing, getting an opportunity to peer review and all.
Um, Talking about peer reviewing, you very recently, got selected as an editorial board member of
Yeah,
Primera, right? So did you apply for that? Did they approach you? What was the?
they only approached me. They have only approached me. They
Um,
have approached me. They sent like a CV. They sent me a CV to fill it up and resend it back to them. We have sent it to them. I mean, I have sent it to them. They sent another mail that you have got selected, and I have become an editorial panel board member of editorial panel.
Congratulations on that. I
Thank
didn't
you.
say that. And
Thank you.
what are your future goals for your, like, in your professional journey?
I want to become a scientist, but it's actually a dream for me. But initially, like starting from CRC, I started. Slowly, I'll reach that position of scientist as well. I'm very much interested in stem cell therapy. We'll see what will happen.
You said CRC, right? So what is your role like as a clinical research coordinator?
Yeah. Currently, we are dealing with data, like data handling, electronic data capturing will be there, segregation of the data based on our requirements, organizing the data, and then it will be like representing the data in tabular forms or graphical representation of the data, and then helping in medical writing, and then publishing. Currently, it's near the data level only. After that, we'll be going to writing level, medical writing and all. Still, we have not started writing.
Thank you so much for such elaborate answers. Now we can take question and answers. So if our viewers, you guys have any questions, please send them in. Type them in chat box, please. You can ask questions. If you guys have any questions, please ask them. We have a question from Shehnaz. What are your researches during your academics?
Are they asking about project work?
I think so.
Yeah.
Saddam.
Our project was based on recovery rate of poisoning patients with or without antidote administration. So it was like comparing the recovery rate whenever if antidote is administered to a particular patient, or if antidote is not administered, then is there any recovery rate. Like some procedures will be performed in the hospital setting, like gastric lavage and all, so that could also help in removing the poison from the body. So our study was like to check the recovery rate by comparing these two characteristics: antidotes, whether if administered, what is the recovery rate; if they are not given, what is the recovery rate. That was our research. And also I
I think
have
that was.
yes. And also we have participated in publishing case reports and all.
I think Shanaz has a more detailed doubt. Can you please rewrite that? And I'm unmuting Mukaddam Sadi so he can ask.
Okay.
Yeah. Uh, Hi, ma'am, and thank you so much for elaborating discussion on this. So I would like to ask this question to ma'am. Like, recently I have came up with a post in LinkedIn, and some unknown sender, she sent me that you can send your journals and we'll publish it. And also I have seen few days back also, like they are demanding some money to publish research papers in their journals. So how do you cross check with that? Like, is there any way to cross check and do and not fall for prey? Like your expert opinion on this.
Yeah. Like most of the predatory journals, what I've observed is they'll be saying that they are indexed in Scopus, they are indexed in Web of Science, ResearchGate, and all. They'll be saying all big names. So if they say that their journal is included in Scopus and all, we can directly go and check to the official Scopus portal. There will be UGC net portal will be available where we can go and like there will be a Scopus portal, like Scopus indexing section over there. So we can directly go there and we can cross check if it is really available in the Scopus or not. Their detailed description will be there regarding Scopus, like from which time till which time this journal is indexed in Scopus. If it is also indexed in present, also we have to see. If it is also there present, like it, like from so and so time till present, if it's there, then we can go ahead. Or else most of the predatory journals, what I've seen is they'll be saying all big names like Scopus Index, Web of Science Index, all Publons, PubMed and all. And don't blindly believe all these LinkedIn messages and all. Even lots of time we'll be getting mails also from some journals. They'll be sending us mails to publish in their journal and all.
Thank
I
you.
also unmuted Shanaz. You can ask now.
Hi, ma'am.
Hi.
I'm asking about the researchers, how you got selected to CRC after early your PharmD graduation.
How I got
Like
selected?
I think you did certifications, research certifications, right, ma'am?
Yes.
I'm asking about those, how you approached about those researchers certification courses and how you selected to do that, ma'am.
Actually, I have not done any course on clinical research, like specifically. Like in general, outside we'll be finding so many courses like medical coding, clinical research, and all. I have not involved in any of those courses, but I have published a few cases, and there was a walk-in interview in AIG hospital conducted. I attended that walk-in interview and got selected for CRC position. Like I have not done any course on clinical research, like particularly.
I'm not asking about that, ma'am. Did you done any in your academics? Did you done online or offline certification courses? Online, like Swayam app is providing many certification courses, no,
Yeah.
ma'am.
I thought of enrolling into them. I have enrolled into few, but not getting enough time to focus on them. They will also be helpful for us, but I have not done anything. They'll be helpful because gaining knowledge is very much important for us. If we have that knowledge, then certification will definitely be helpful. because 5M is a
Okay.
trustworthy portal only. Like it's from Government of India, so it's a trustable portal only. If you are very much interested, you can go ahead, because enrolling into those courses will definitely be helpful. I have not enrolled till now. I'm trying to pursue.
Okay, ma'am. Thank you, ma'am. I
Thank you.
think you published your own researches, right, ma'am?
Yes, yes.
Through that, there is an interview in AIG hospital. Through that, you got selected, right, ma'am?
A lot of walk-in interviews they'll be conducting in hospitals, right? So in that interview, I came to know there's a vacancy for CRC. So we went for that interview, and the interview was done, and we got selected.
May I know one more question, ma'am?
Yeah.
Other than CRC, any any what? Sorry,
It's okay. It's okay.
any vacancies other than CRC in AIG hospitals, ma'am? Because I am now intern, ma'am, PharmD intern. I
Okay.
want to know about that AIG hospital. I came to know before only, ma'am, about that AIG hospital.
Okay. For form days, they'll be taking for physician assistant, for a clinical pharmacologist, for clinical research coordinator. All these three they'll be including form days only. And coming to present current situation, maybe I think there's a vacancy for physician assistant in AIG. I think maybe, because we
Just
won't
a
be knowing
second,
much.
ma'am. Can you
Yeah.
please repeat the
Okay.
vacancies?
Okay. Form Ds are eligible to be to be enrolled, like to get a job in the field of physician assistant, for a clinical pharmacologist, and for clinical research coordinator as well. So if you are interested to become a clinical pharmacologist, you can proceed. CRC also you can proceed. Physician assistant, currently there are vacancies in the post for physician assistant. This is what I just have knowledge about it. That's it. About CRC and CP, I don't know much about it, because most probably HR will be knowing about vacancies and all. We won't be having that much knowledge about current vacancies. So for Form D, they will be taking for physician assistant, for clinical research coordinator, for clinical pharmacologist as well. So if you want to become a clinical pharmacologist also, it will be good career opportunity.
Okay, ma'am.
I
Thank
think
you,
I have
ma'am. Very
answered.
insightful information.
It's okay. Thank you.
I would like to add to Shahnaz's question. As a fresher, when we are applying, what do you think they look for in our resume, for especially for a research coordinator position? Oh, I'm sorry. Just a second. We can't hear you. I need to unmute you.
Okay. Can you hear me now?
Yeah. Yes.
Okay. So for clinical research coordinator, we need to have a thorough knowledge regarding clinical trials, as well as we need to have a good knowledge about ICH GCP guidelines involved during clinical trials and all. And publications will definitely be helpful. Like I will not say ki publish so many case reports. I'll say I can at this point I can say ki even publishing a one case report which has got so much information in it, like useful information content in it, so that can be helpful. So try to publish how much you can, but try to maintain the quality as well. Publications will also help you in getting a CRC position, because it's also a part of research. And I'll suggest everyone to write review articles as well, because review articles will help us to reach more wider audience, and also they'll increase our scientific score itself. So that also will be helpful. If you can write reviews also, it will be nice, a good opportunity.
Next question is from Peryasamy. Before publishing a manuscript, what are the parameters to be taken into consideration?
For every different journal, there'll be specific guidelines will be available in the journal website itself. They'll be mentioning in detail. There will be one section like guidelines for the authors. So kindly go through that section, because there they'll be mentioning everything that they want to be included in their manuscript, like how the manuscript has to be structured. Most commonly the structure will be like abstract, keywords, introduction, case presentation, discussion and conclusion, and then abbreviations, conflict of interest, acknowledgements and all. This is the basic thing which will be same for everything. But for some journals it will be like specific, they'll be giving guidelines. So we have to follow that specific journal, specific guidelines. So by going through the guidelines thoroughly, we can modify our manuscript based on that guidelines, and then we can send it to the journal again.
Okay. Maliha is asking, is there any Scopus Index journal that is free of cost?
Yeah, there are so many journals. Scopus Index will be free of cost, but we need to search a lot. After searching, we'll be getting them. But there are journals free of cost. But like we need to have a lot of patience and we need to search for them. They are available.
Okay. Najia asked, ma'am, what are the interview questions that can be asked for CRC position? I think you already answered that. So you said mostly clinical trials, ICH, GCP guidelines, right?
Yeah.
So the other roles you were talking about, like clinical pharmacologist and physician assistant, are
Yeah.
also open, right? So
Yeah.
what is the difference like in interview? So what do they focus on? Do you have any idea?
In clinical pharmacologist, I can say they'll be asking deep questions regarding to pharmacology. Because in one hospital, I have given an interview for clinical pharmacology position as well, like for clinical pharmacist position, because directly they won't be taking us for a pharmacologist. I think some hospitals they'll be taking, some they won't. For clinical pharmacist I went, it will be similar only, I guess. Like they asked me regarding doses of the drugs, classification of antibiotics, antihypertensives and all. They asked little bit doses. Like they even asked me regard, I told them that we got some major drug interactions during our internship. So they asked me regarding major drug interactions, like what all major drug interactions you have seen during your internship and all. They asked me. So yeah, drug interactions also, they are very important. Adverse drug reactions are very much important if you want to become a pharmacologist. And also classifications of basic drugs is also helpful for cracking the interview.
And what about physician assistant?
Physician assistant, you need to be having some little administrative skills as well. Like you should be good at communicating the patients, because being a physician assistant, you need to take patient history. So you should be very good at communicating with the patient, so that they can feel free and they can explain you all the their clinical history and all, like what are the chief complaints, what they are facing and all. And after that, also we need to give counseling to the patient regarding the diet to be followed, lifestyle modifications. We need to explain them regarding drugs, when to take, what to take, how to take and all. So communication is definitely helpful, and we need to have all the basic knowledge regarding the diet, like diabetic diet, what should be explained to the patient, hypertensive diet, like renal diseases, if they are having, what they should take, what should avoid and all. These will be asked. Basically for physician assistant, it will be like communication skills matters, and even subject knowledge also matters.
Okay. The next question is by Spurti. She's asking, can you suggest some journals that are free of cost for publishing clinical cases? And a follow-up to that is, can you name those journals?
No, I cannot name actually. We need to go to the Scopus portal and we need to search, keep searching. Exactly, like annals of, I have seen one journal, and I can't remember the full name of that journal. But there are some journals, some very good journals in Scopus which are free.
Okay.
Because if I say the name of one specific journal, then it can't be it also depends on the subcategory of the topic which you are conducting, like which you want to report. The annals of medicine, annals of pharmacotherapy, I don't know whether they are free or not, but I have seen one, like recently one of my friend, they have published one article in a journal which is free of cost. Can you give him 1 second so I can see it and see?
Yeah.
I don't remember the name because journal names will be some.
While Dr. Aparna searches, if anyone wants to unmute themselves and ask, you can do that.
Annals of hepatobiliary pancreatic sciences, I think. Pancreatic surgery. Annals of hepatobiliary pancreatic surgery. This is a free journal only. My friend has published in it. It is also Scopus indexed. but she has published it under the guidance of senior most consultant in the hospital where her internship was done. So we need to go to the website, Scopus website, official website, and we have to go to the journal website as well, because in Scopus directly we can't get the publication charges and all. We need to visit the journal website, and we have to look forward, and we need to look everything so that we can get whether it is free for publication or they are charging some amount for it. We'll get clarity.
I think that is the end of the question and answers. So with this, our session comes to an end. Thank you all for joining us today, and thank you, ma'am, for this engaging conversation. And we've had a conversation about peer reviewing, case reports. We also talked a little about interviews, job interviews towards the end. So thank you so much for this engaging conversation, and see you all next time.
Thank you for inviting me. Thank you.